Welcome to The Blueprint of Healing, where we explore how the golden age of Arabic medicine, spanning the 8th through 16th centuries, architected modern science. The quote, great synthesis involved importing raw elements, like Greek, Persian, and Indian texts. This input was processed through the translation movement, centered in Baghdad, resulting in original innovations such as correcting anatomical errors and inventing new surgical techniques. Women played a critical role, breaking boundaries at the front lines. Rufaida al-Islamiyya established the first mobile field hospital. Meanwhile, academic surgeons like al-Hassan and Sarah bint Ahmed shattered academic ceilings with their rigorous mastery of medical practice and science. The Bimaristan was a state-of-the-art hospital ecosystem, often designed with separate wards for male and female patients, offering specialties like internal medicine and surgery. The core principle was a strict non-discrimination policy, providing high-fidelity care free of charge to all patients. Healthcare was provided without borders, featuring both fixed, quote, urban megaplex Bimaristans and mobile Bimaristans. These mobile units, led by physician-staffed medical caravans, guaranteed top-tier public healthcare to remote rural populations. The profession was systematically regulated, starting with rigorous study of foundational textbooks. Graduates then faced the muhna, the first clinical licensure exams. Upon passing, they swore a medical oath, all under continuous state oversight by the mutasib or inspector general. The ethical code of the physician emphasized compassion, confidentiality, honesty, humility, and mandatory referral. These duties ensured high-quality patient care, professional integrity, and continuous learning. The Golden Age produced masters whose innovations define modern medicine. Al-Razi invented catgut sutures. Ibn Sina synthesized medicine with psychosomatics. Al-Zahrawi architected surgery, and Ibn al-Nafis discovered pulmonary circulation. Al-Razi, the clinical observer, used the scientific method to choose the healthiest hospital site by observing how long meat took to decay. His surgical innovation was inventing the world's first dissolving surgical sutures made from catgut. Ibn Sina, the encyclopedist, authored The Canon of Medicine, which became a global authority. He pioneered psychosomatics, emphasizing that illusion is half the disease, reassurance is half the cure, and patience is the first step of healing. Al-Zahrawi, the architect of surgery, standardized practice globally with his 30-volume Al-Tasrif. He pioneered complex procedures and invented the two-needle technique using silk to create invisible, subdermal stitches, preventing scarring. Ibn al-Nafis rewrote anatomy by disproving Galen's flawed dogma. His breakthrough was the discovery of pulmonary circulation, centuries before William Harvey. He correctly identified that the heart has only 2 ventricles and mandated postmortem dissection. The invention of asepsis involved a system protocol with 3 components. This included chemical antiseptics, thermal sterilization of surgical instruments, and environmental controls like cross-ventilation and sunlight exposure in Bimaristans. The influence of Arabic medicine spanned centuries. The Canon and Al-Hawi were foundational texts in European medical schools for half a millennium. Al-Tasrif remained the primary surgical reference in the Western world for over 400 years. The golden age of Arabic medicine were the architects of evidence-based medicine. Through rigorous institutionalization, ethical standardization, clinical observation, and surgical innovation, they drafted the blueprint for the modern healthcare system.